Hi, I'm Dr. Jeffrey Lewis, Medical Director for Racker. Today we're going to do a session on personal protective equipment, or PPE. Personal protective equipment is for the purpose of protecting you from those you're working with. We've been talking about cloth masks, and those cloth masks are to protect other people from you. But today we're going to talk about PPE that protects you from others. Today I'm wearing a long sleeve t-shirt, which is without a collar on it, probably similar to what most of you are working with, and that's why I'd like to use this for the demonstration today. I'm going to demonstrate for you how to put on the personal protective equipment and also the order in which I'd like you to use it. So the order to don PPE would be mask, gown, gloves, and then the face shield last if you're going to be using a face shield. The placement of a surgical mask is similar to what I described for you when we went over how to use a cloth mask. The mask has stretchies that go behind your ears and a metal bendable plate in the top part to contour to your nose. That should go over the bridge of your nose, and the bottom of the mask should go below your chin. So you'll adjust the nasal part first, getting it snug to the bridge of the nose. You can then pull this down like the accordion and then loop the ear loops behind each ear. Adjust it how you like it, because after that you shouldn't fuss with the mask. Now for the gown. We're going to pretend that I still have the mask on, but I want you to be able to see when I speak with you and hear me better for the purpose of this video. So the gown, you're going to lift up by the shoulder sections and kind of shake it out so you can see where your arms go in. The arms get inserted just to the point where at the base of your thumbs is where the elastic comes there. Then adjust it around your neck. And some of these are pretty flimsy and are hard to find the ties for, but you can have somebody help you with this part if you like. Like I need help right now. Okay, there we go. You then bring it up to your neck and tie it behind your neck. Again, you can have help with this part. Then adjust it around your neck, adjust it around your waist, and then use the ties at the waist to secure this snugly. Now for the placement of the gloves. So you want to open the cuff of the glove so that you can slide your hand in, getting all 5 fingers in place, and then bringing the cuff of the glove up over the cuff of the gown. Do that on both sides. I've frequently been asked if it's okay to wash your hands with the gloves on or to use hand sanitizer with the gloves on, and the answer is yes. Now for face shields. I'm going to first put the mask back on so you can see the whole thing assembled. Remember, you would otherwise have your mask on before putting on your gloves because we don't want you touching your mask and face once the gloves are on. But if you do, you can use a hand sanitizer or wash your hands. There are a couple different types of face shields. This is a type with a plastic shield in front and a headband type of appliance. All you do is bring this up to your forehead, touch it to your forehead, release and position the sides, and there you go. Another type of face shield has foam along the top and the elastic to hold it onto your head. These are a little trickier to put on, but they work just as well. Again, you adjust it to your forehead, then you stretch it to adjust there, and you're all set. Now, removal of the PPE, assuming that you've worn all of what I've just demonstrated, is going to be in a different order. You're going to remove the gown, then the gloves, then the face shield, and then the mask last. I'm going to demonstrate for you how to remove all these as if the PPE that you're wearing are going to be discarded with rather than processed. Assume that they're contaminated, and you want to prevent yourself from being contaminated when you remove the PPE. Again, you're going to remove the PPE, starting with the gown, as if it's contaminated, and you don't want what's on the outside to contaminate you. So you'll have somebody untie the waist tie and the necktie, then you grab it at your collarbones, pull it forward, and then you can pull your arm out, turning this inside out, grab it in the same place on the opposite side, pull your arm out, turning it inside out. Now you can fold it, roll it up, and throw it away. Doing it in that order, in that sequence, keeps all the contamination away from you. Anything you're touching now was the inside of the gown, not the outside of the gown. Next, we're going to remove the face shield. I'd recommend using a little hand sanitizer on the gloves before you do this, and that decreases the likelihood of contaminating the headband. So you'll just reach up over the temples, pull it apart, take it off. You can put it down for disinfection. We also want to use a technique where you turn the gloves inside out to keep the contaminated surface away from you. So you'll come up here to the cuff, pull the cuff away, and turn the glove inside out. Now, with the other hand, scrunch it up like this. Now you can pull this off and turn this glove inside out. Now, anything that you touch here was on the inside of the glove, not the outside of the glove. So if there's blood, body fluids, urine, feces, you've contained that all on the inside. Finally, removal of the mask. Take it by the ear elastics, bring it forward, and you're all done. This can be deposited in a paper bag if you're going to reprocess it. And the same thing with the KN95 or N95 masks for reprocessing, and we'll get to those later. So that's a review of how to place and remove PPE or personal protective equipment. We want to keep you as safe as possible, and that's why we reviewed both the technique and the sequence to minimize the likelihood of you becoming contaminated when working with others who are ill. I'm Dr. Jeffrey Lewis, Medical Director for ACR. Thanks for watching.